My name is Matt. I'm from Dublin and I'm 23. I'm here in One Hatfield Hospital today getting a procedure called a bilateral mastectomy, or more commonly known as top surgery, with Mr Inglefield. My experience at One Hatfield Hospital has been amazing. Like, the facilities in general are like gorgeous. It's really, really lovely here, and it's so clean, and the staff are really friendly. I felt like immediately at ease with everybody here, that there was such a sense of if I needed anything, that I would totally be looked after, and that me and my friends and I were really accommodated. I think that initially when I was looking into the surgery, because it's something that I've wanted since I knew what top surgery was, so I suppose like top surgery is kind of like a masculinizing, gender affirming surgery for trans men or trans masculine people. What really drew me to Mr Inglefield was the fact that that's how he approaches that surgery, is that it's very much about you being affirmed in your gender, and that it's like an exciting process, and it's, you know, it's meant to be really happy, and that they want to make sure that you get the best result possible for you. I read like a handful of reviews about him and saw the way that he narrates how he goes about this procedure. I was like, absolutely, this is fantastic, because initially I'd wanted to do it somewhere else, and then liaising with my nurse in the London Transgender clinic, Mary Burke, she recommended the surgeon, Mr Inglefield, that is linked in with the London Transgender clinic, and immediately I was totally put at ease when I met him. I couldn't imagine now getting surgery with anybody else, which is really lovely.
I am Mr Inglefield, specialist transgender surgeon here at One Hatfield Hospital, and I have been the lead surgeon in charge of Matt's care. Matt was very dysphoric about his chest. We see that commonly with patients, especially if they've started testosterone, is that they increasingly become masculine. So they get facial hair, their voice deepens, they start to put on a bit of muscle bulk. So they pass even better in their male role, but then their presence of breasts becomes even more incongruous. So chest surgery is a very important part of their transition and gives them their quality of life to go and do things that any other individual would just comfortably do. Go to a gym, go to a swimming pool, go to a beach holiday, change in front of their partner, all of those things. With the consultation, we get a full history and an examination of the patient to ensure that it's the right thing for them at this stage. They do have to have a psychological assessment in order to have chest surgery. 2 weeks before surgery, one of our nursing team do a preoperative assessment for that patient, giving them all the information that they need in preparation for the hospital admission, and also for during their recovery, so that they're fully informed of everything there. So following surgery, Matt would have big bandaging initially for the first 6 days with drains, and so his first appointment back in the clinic would be after 6 days, when we would take all the big bandaging off, remove the drains, make sure that everything's healing well, make sure there's no signs of infection or bleeding, and then Matt would just continue with light duties, so which means no heavy lifting, no vigorous exercise for 6 weeks after surgery. We would then see him back 2 weeks post-operatively to remove the main dressings, ensure that everything is healing well, advise him about the care of the scars, because that's an important part of the management long term. Then I would then see Matt at 6 weeks, 3 months, 6 months, and 1 year. So we keep an eye on all our patients for up to a year after surgery to ensure that they've achieved the result that they want to achieve, that the scars are as good as possible. We just love the environment at One Hatfield. From the minute you walk in through the front door, it's a welcoming environment. The reception team are always greeting you with a happy smile and in a welcoming manner. The staff at One Hatfield are amazing. They are a great team, both on the ward and in the operating theatre. It fits with our standard of care that we aim to provide for our patients, which is the highest standard that could possibly be delivered. And One Hatfield ticks all the boxes for us.
Mr Inglefield, his team and the staff at One Hatfield, they're amazing. They're so good. Like, they're really, really lovely. They have a real kind of holistic approach to how they engage with you as a patient. And I suppose from experience, I felt like really seen as a person, really respected as a man. So many different things were taken into consideration to make sure that I was comfortable, that I knew everything that was going on. That, like, I was getting responses like in less than like 5 minutes from emails, any questions. And then when I finally got to meet Mr Inglefield and some of his team, like some of the nurses and stuff and the staff here, they were just incredible. They were really, really kind to me, made sure that I was relaxed and that if I needed anything or if I had any last minute questions. So I felt really safe. Do you know, I feel really, really safe about this surgery, which is really, really nice. One thing that I have experienced while here is that like there isn't a sense of like kind of doom and gloom that sometimes comes with hospitals. Been able to like have a nice laugh with some of the nurses who've been looking after me here, but it's quite a calm environment as well. Like there's a nice garden, there's a nice cafe for like the people who are here with me to kind of relax while I'm getting my procedure done, and it's kind of, I guess, removed as well from the chaos of the city a little bit. So it is quite like a calming environment to be getting a procedure done. So I'm grateful for that, and it's very beautiful here.